Again, good afternoon, colleagues, students, ladies and gentlemen. Welcome everyone to join the webinar today. So on behalf of Utah CRCD, I am very pleased to introduce to you our speaker for today, Mr. Lawrence Fong, who is going to talk about dementia, which is labeled as the silent killer of the brain. As dementia is a group of diseases which affect the normal function of the brain. And this can be very overwhelming, not only for the people who have it, but also for their careers and families. So Mr. Lawrence will speak to us on the causes, signs and symptoms, diagnosis and treatments for dementia. Let me give you a brief introduction about Mr. Lawrence. So Mr. Lawrence was born in Ipoh, and he started his profession in nursing and had served the National Health Service in United Kingdom as a registered general and mental nurse for about 34 years. He was with St. John Ambulance in United Kingdom for almost 14 years. He is also a licensed Western medical acupuncturist under the British Academy of Western Medical Acupuncture. In the year of 2018, he had published a book entitled First Aid in Mental Health, which raised the mental health awareness. So without further ado, ladies and gentlemen, please join me in welcoming Mr. Lawrence to share his insight with us today. If you have any inquiries or comments about the contents of the talk later, please post it in the chat box or wait for the question and answer session after the talk. So we will respond to that later. I think, yeah, so I pass the floor to Mr. Lawrence. Mr. Lawrence, you may start your presentation. Thank you.
Thank you very much. Good afternoon all. I hope everybody is safe and sound, have had at least one dose of vaccination. And we hope that everything is okay. Now we talk about the mental health on dementia. Before I start on this, I usually tell a story on the mental health story. So what we are talking about, what do you mean by dementia? What does it mean? It means a lot of things for many people. So let me tell you a story. A couple of people, husband and wife, are having problem in remembering things during a checkup. So the doctor tells them that they are physically okay, but they might have to write things down to help them to remember things. So later that night, while they're watching TV, the old man get up and from his chair and say, do you want something while I'm in the kitchen? He asked. Will you give me a bowl of ice cream? Sure. Do you think you should write it down so they can remember it? She asked. No, I can remember it. Well, I like some strawberry on top too. Maybe you should write it down as you won't forget it. He said, I can remember that. If you want a bowl of ice cream with a strawberry, I like to some whipped cream, and certainly you'll get that. Write it down? She asked. Irritated by the wife's request, he said, I don't need to write it down. I can remember it. Ice cream and strawberry with whipped cream. I got it, for goodness sake. So, then he tottered into the kitchen. About 20 minutes later, the old man returned from the kitchen and handed his wife a plate of bacon and eggs. The wife stared at the plate for a moment and said, where's my toast? So basically, the story gives you an idea what you mean by dementia. So when we talk about dementia, it is a group of diseases that affect the normal function of the brain that can affect any of us, whether you're intelligent, not intelligent, or even a professor. I come across a lot of people are very highly function person, leaders, you know. So it is most important that it is affect the function, the logic of the brain. Especially we are talking about short-term memory, part of the brain it affects. So in a regression back to the child, as we go, we're suffering from dementia. It's like from an adult, go backward to become a child. So the disease, the people who are suffering from the disease, not only themselves suffer, the whole family suffer, because this is not a physical illness like high temperature or fever and things like that, but it is affect the person's thinking. So very important, because we are a loving family, we care for our family. So like my brother, my father, my sister, any of us can suffering from dementia. So it affects the whole family. So the most common dementia we're talking about, like vascular dementia, Korsakoff syndrome, Lewy body dementia, Pick's diseases. These are the dementia, it's a group of diseases. These are less common. Of course, we're talking the most common one is Alzheimer's. So we don't, in here, I'm not particularly want to talk about what is the difference within them. Basically, they have the same problem. Okay, affects the mental, the brain, physically affect the brain. The most common one, of course, is Alzheimer's. The vascular dementia is quite often come with cerebral accident or having a stroke. Korsakoff syndrome is another usually due to drinking with alcoholism. Lewy body dementia and Pick's disease is just a part of the dementia or the common diseases affect different part of the brain. So what are the causes of it? Unfortunately, as you know that everything in inheritance, you know, we inherit our father's good look, mother's beauty, intelligence, but unfortunately, we also inherit their diseases in the family. So quite often, when someone's suffering from dementia, the first thing the doctor will have to ask is, do you have family history, your relatives having that? Quite often, they ask a very simple question: have you had any accident or brain injury or trauma to your brain? Stroke, of course. Now, aluminium poisoning is one quite common causes of dementia. So this is something that people who use a lot of aluminium cooking utensils to cook their food, quite often, I'm talking about long term, it actually causes dementia. So it is important that quite often, once the aluminum pots and pans are not used, and quite often people can get recovered from the poisoning, which causes the dementia. So chronic alcoholism that we were talking about earlier, Korsakoff syndrome. Right. Another causes is air pollution. Now we don't understand that when we live in the city, we have too much air pollution. Quite often, it is scientifically proven that people live in the city get more dementia rather than people live outside in the countryside. So poor quality of sleep. Now in 2021, they talk about lymphatic system, which actually control the internal fluid cerebrals, clear the brain. This system regulates the brain amyloid clearance by the perivascular space that surround the cerebral blood vessel. Activity of the lymphatic system is higher during sleep and lower or disengaged during wakefulness. So sleep is very, very important in terms of dementia. So people who have poor sleep or lack of sleep, suffering from insomnia all the time, are most likely get dementia. Of course, diet, of course, we know that we have too much fine carbohydrate, animal proteins, and all the saturated fat. So it's so important. The diet is very important that we have the proper diet, not all this junk food. Of course, mentally, psychologically, stress, anxiety, and depression is also the trigger point of dementia. Now we're talking about age group. People ask, what do you mean by when we get dementia? How would medical classify dementia? Quite often, people in medically, we're talking about pre-senile dementia, usually below the age of 65. Then we call it pre-senile dementia. And senile dementia is usually after 65. Unfortunately, nowadays, I think due to pollution, bad food, toxic food, and all sorts of toxic things happening, we're eating, all the chemistry, the dementia are getting younger and younger. So what we see, it's quite often now happen that, 55, even 50, the signs of dementia are very obvious compared with the old age. The onset, coming on is usually very, very slow. The prognosis, what is the future, how we look at it, unfortunately, is very, very poor in terms of medical prognosis. Now, what are the early signs and symptoms? How do we detect maybe something suffering from first signs of dementia? It's quite often the behavior changes. Their normal behavior seems to be a lot of very odd behavior starts coming in, which they don't normally behave. People, close relatives notice some really strange behavior changes. People. Now, language impairment happen coming in. They may seem to forget to talk, or they're unable to talk a certain language or even the mother dialects, and yet they can speak foreign language. Quite often, you find that people who start early sign of dementia, they seem to forget words or forgotten a certain word which is commonly used that normally the person will have no problem of recalling anything. The impairment of executive function like self-care or hygiene, something showing sign they forget to be able to shave themselves or wash themselves or even use the toilet. Now, short-term memory loss. When we're talking about short-term memory loss, it's like if I say to you, it is an apple, orange, banana. If 5 minutes later, I ask you what I say to you, the three fruit, you're usually able to record it, But quite often, early sign of dementia, they cannot remember what is happening. The best story is say that they can't remember what happened they have for breakfast, but they can remember every detail, what happened 20 years ago, incident happening. So their last long-term memory is very good. So this kind of short-term memory is progressively getting worse. This is the signs of dementia, early signs. So totally short-term memory loss is the final symptom in that sense. That's why it's very important to understand the reason how they behave, because the short-term memory loss is so bad. If you understand that, then when you look after someone with dementia, it's easier because you know what is happening in their mind. So when the final sign and symptom, besides a short-term memory loss, is totally disorientation, confusion. They seem to lost even in their own home surrounding. They always seem to live in the past. They're looking for their son, for example. They were looking for, I'm looking for my son, and the son is grown up right in front of him. You will say to your mom, I'm still here, but mother is looking for a 10-year-old son of the same person. So they seem to live in the past more than in present. The progressive loss of ability of self-care is a very important sign of dementia. They're not able to seem to look after themselves or care anymore about their own hygiene, appearance, looks, or even want to eat. Now, delusion, I know there's a medical term here, is the false belief that not coming up from their own cultural background or race or religion. So delusion is something, is a false belief. They start believing things that something is coming, going to murder them, or someone going to come and rob them, and yet there is no such evidence happening. Hallucination is a word that we use, that the person actually starts seeing things, hearing things. You and I don't see, but if people are superstitious, they say they see ghosts, bad, evil spirit. But hallucinations are real to patients suffering from dementia. They're actually seeing things or feeling things. So it's very important to believe and also give lots of reassurance. Aggression, why they become aggressive is quite often we do not understand how they feel. If you understand, as I said earlier, their short-term memory loss are very bad. Whatever you say to them, they may listen, appear to understand, but within 2 seconds, they've forgotten about it. So like you're trying to change the persons when they're dirty, they're incontinent. Now you tell the person, I'm going to help you to change your trousers, and wash you. The person may appear to be understand, but when you start trying to help him to pick up the clothing, they become aggressive, like you are trying to invade their privacy or trying to molest them. That's how they become aggressive. They start to fight back. So eventually they cannot seem to be able to walk. They start become crawling on the floor like babies. And eventually they are not even able to walk. They become bedbound. And yet you find that there's no real physical causes of it. There's no fracture or injury to the body. So there's no real cause, and yet they seem to go aggressive back to the babyhood. Then, of course, they become bedridden. They can't do anything for themselves. They're incontinent, wet themselves, dirty themselves on the bed. They can't, of course, can't even feed themselves. So, what are the treatments for dementia? In the early stage, there are new drugs. Although now, eventually, they have some new drug trying to prevent or delay the full development of dementia. It delays usually about 5 years. Quite often, dementia affects individually differently. Some people affect the dementia from someone walk into my ward, walk in, and yet within 3 months, the person becomes bedridden. They can't even walk, can't do anything for themselves. And yet, I've got a patient that can come in, and 4 years later, they're still wandering around. Although mentally they may not be alert or understand what you're saying, but physically they are reasonably quite well, actually. So in terms of treatment, we usually tend to treat systematically on symptoms rather than the dementia itself, because you can't really, there's no treatment for it. So we are treating only symptomatic treatment on physically any illness. There unfortunately no cure yet. There is a possibility, the latest research, there may be a sign of a possible cure in the next 30 years, possibility in that sense. What are the nursing care? If you look after someone who is mentally demented, it's very important their behavior. Although you quite often look after them with their personal hygiene and safety, it's very important. Safety is a very important thing, because they're wandering off, they don't know the danger. They can walk across the road without actually looking out for cars or moving vehicles. So this danger, they cannot see danger and their surroundings. Diet intake, most important thing is quite often to prevent constipation. Now, the reason is when we want to go to toilet, we go to toilet quite naturally. But when the patient suffering with dementia, they cannot seem to understand that the urge of going to the toilet. Therefore, they start defecating everywhere. Because when they cannot hold it any longer, they cannot look for the toilet. Quite often when you help to after some dementia, you notice they become agitated. It's important to show them where the toilet is. Quite often they are looking for toilet. But no point showing that that is a toilet and point to that. And yet, when you turn around, the person is being around the corner. Because your instruction or direction, they cannot retain. You need to physically take them to the toilet so that they can use the toilet. Literally, you have to sit the person down on the toilet. So, nutrition is very important because somehow, as we grow older, for some people with dementia, the body doesn't seem to be able to absorb the amount of nutrients that normally a person would take. Can't understand it quite often is that the person starts to lose a lot of weight, lots of physical body from a very fat person become a very thin person. And yet the person is not given food. They're given good food and things. So sometimes the food that you give to the patient, you may need some nutrient supplement like Complan or Ensure or these things. You may give them to supplement the intake requirement of the body. So mentally, orientation is very important. Orientation means you tell the person where they are all the time. Quite often, the patient who is suffering from dementia, they cannot associate even their familiar surrounding. They may familiar with the surrounding, but they don't know who is who. They may look at their son and daughter. To them, it's a stranger with a very familiar face, but they don't know who they are. That's how they are totally out. Orally, they make sure they are need dentures to eat, or they need soft food. I find that in terms of looking after care for the elderly with dementia, funny enough, musical instruments or songs and music, they always love to enjoy it. They still retain the enjoyment of music, especially during the time. Now, no point telling them, give them nice music of the modern one when they're living in the 50 and 60. So like people like me, we live in the 50 and 60. Elvis Presley is more important than the latest girl group or whatever. So the music you produce or give them stimulation must be catered during their period of life, the early time. If they're born in the 50s, so you give them the 60 music. The 80, you give them the 80 music. So don't give them the modern music. You think that it looks sound very nice, but they're always, even no matter how badly demented they are, they always enjoy the music. When you play them, you can see their hand and tapping that they enjoy the music. So rehabilitation and diversion therapy. Now we assume that we do things always all the time, but you may need to retrain the person like toilet training. How to train the patient go to toilet. Now, they cannot associate it with the urge of going to the toilet, the physical urge. Then they look for toilet. And yet there's sometimes when they cannot hold it anymore that the frustration comes in. That's why they couldn't find the toilet to be on it. So no point, I say, showing them or tell them where the toilet is and then you don't take them. Because within 2 seconds, the person don't know where the direction is. So in order to relieve themselves, they just go in the one corner and just do it. I think some of us experience it, especially men, when you're so urged in the middle of nowhere, you're looking for a tree or behind the bush. But with people with dementia, they don't know how to look for it. Diversion therapy means actually you divert the interest of the patient, give them something, stimulate them to do, give them something new to do, especially like group music or even some cartoon to watch it. Like you are treating a child again. So tender loving care is the most important thing. You have to understand the mentality of the demented patient. Don't always say that, I really told you where the toilet is. You did it on purpose. Because you treat the person as a normal person. You expect them to behave normally after they've been told or directed. But demented patients don't. They will just forget within 2 seconds. So because you know that they don't do it on purpose, they don't do it in spite of you. Quite often people that do not understand dementia, they always think that, oh, my father or my father-in-law did that purposely in spite of me, even I told them where the toilet is. So because they do not understand dementia, that's where they get frustrated, get angry, get personal. So the cause of death of dementia quite often is not the brain dysfunction, it's quite often other physical illness, chest infection. People with chest problems, especially nowadays, talking about COVID-19. So very important that chest infection, they cannot express, they can't breathe or they're uncomfortable. When looking after elderly people, look out for 3 things. Make sure they don't have chest infection, make sure they don't have urinary tract infection, and they are not constipated. If you solve these 3 major problems, looking after the elderly with dementia are quite easy. So the poor physical absorption of nutrients, the poor resistance of infection. So it's important to give them good, simple, nourishing food. Nowadays, with so much nutrient, the supplement that are available, you can get a glass of ensure be equal to a meal. So it is best to give them all these nutrients that we can get. So duration of lifespan of people suffering from dementia, average is around 5 years based on the general physical fitness. So you cannot say someone that having dementia will die quickly. As I say, I look after the patient with dementia. In fact, outlive their husband who is physically fit, who come and visit them often, and yet they outlive their husband. And yet someone who is so appeared to be physically fit and came into the ward, within 2 years, within a year, they literally deteriorate so much and they literally die because of other illness like chest infection and anything else. So the lifespan is average is around 5 years. Some people are suffering from dementia. Okay. So how do you avoid Alzheimer's disease? Keep the brain active. Quite often people who have his family history of dementia, it's important to keep the brain active. Do something like crossword puzzles, problem solving, board chess, games and things like that. Keep your brain active. It's one way. Exercise to prevent any chronic hyperpressures, high cholesterol, cardiovascular disease, and stop all these coronary cancer, all these diabetes, obesity, depression, etc. So we do some exercise. But important thing to remember is don't do too much. do gentle exercise. That is more important. The diet, of course, we always say that Mediterranean diet, that means more fruit and vegetable, grain, oils, wine, a small amount of meat and poultry. So the less meat we got, the better actually. So sometimes it's important to know that the diet we're taking is very important to give a very well-balanced diet to help keep us away from Alzheimer's. So keep in touch with friends. Keep a pet. You find that you have a dog or a cat will help you to have a calming effect for the elderly, especially with dementia. You find that in the Western world, in UK, sometimes we have what we call pet a dog. A society will bring a dog into our day hospital and let the elderly people and pet the dog and stroke them. The stroking of the dog, you give them calmness so that they will keep happy. They love, especially people with dogs have hobbies of that. They love animals, especially cute little animals, they love it. So try to introduce some new hobby, gardening, anything that person may be interested. So it's one way of keeping in touch with friends. Keep your friends on, play a bit of mahjong, it's good for you. So when come to it now, we are talking about, it's nice and good to know that something can help prevent dementia. Champagne, sparkling wines are made roughly the same as wine, but the more yeast is added, the less the fermentation in the bottle, a second time to release carbon dioxide. Now, the antitoxins in the champagne help to prevent and protect your brain from damage during a stroke against neurological disorders such as Parkinson, Alzheimer's disease. According to a team of researchers from University of Reading, they found that high levels of antioxidants called caffeine and caffeic acid and tyrosol help to prevent and protect the brain from damage. So, ladies and gentlemen, do have a lovely sparkling champagne or wine. If possible, every day, if you can afford it, of course. Now we are friends. When we are old and senile, then we are new friends. Okay, any question? Hello?
Hello. Hi, Mr. Lawrence. Wow,
Hi.
thanks for your sharing. Okay, participants, if you have questions, you may pose it in the chat box. But I have collected some questions when they have registered, Mr. Lawrence. Some questions actually are answered from what you have shared with us in the slide just now, but I still want to ask a bit more. As the question sounds like this, so dementia is actually hereditary, right? So how any statistics number to show the history of dementia that is family born, like how frequent? Like my mom, she's an Alzheimer patient. So what's the percentage of me as her daughter getting dementia?
Unfortunately, the question is how long is a string?
Sorry?
It's like asking how long is a string a string, or rope, okay? But basically, there is no real answer because the percentage of having dementia, if you got family history, your close family have dementia, so your likelihood to get dementia, the percentage is higher compared with normal people that don't have any family history of dementia, close relatives. Now, besides the dementia that I say, the inheritance is only part of the causes, but of course, like strokes or car accident, brain injury, and trauma, that can cause the dementia as a, if you look at the causes, and of course, excessive drinking, alcohol, and also reduce the different type of dementia. Although, as I say, Alzheimer is the most common dementia, and the other like Korsakoff syndrome, Lewy body, Pick's disease, they are all dementia, but it's affect different part of the brain. But at the end of the day, it's the general function and memory is affected. The most common, as I say, is Alzheimer's. So, what is the chances of you getting dementia? Is again based on your, unfortunately, your inheritance. If you got more people in your family get dementia, then you are likely to get higher. Just like cancer, if your family have a lot of people suffering from cancer of one type or another, the most likely you also get cancer more likely. If you don't have any family inheritance of getting certain diseases, so you're less likely to get them. Answer your question?
Yeah. Thanks, Mr. Lawrence. And regarding to that, yeah, because I love alcohol, is when you mentioned about chronic alcoholism. So this will cause dementia as well. Like
yes.
What is the chronic here referring to?
Actually, the dementia caused by alcohol is called Korsakoff syndrome. Actually, that type of dementia is that the person who drinks excessively can have a certain amount of degree of dementia. They become, because they are quite intelligent, because they can still function normally, then they able to hide their lost memory with giving rationalization. Let's say they can't remember going to a certain place, and when you ask them, they will give you all sorts of excuses, the reason. So they know they cannot remember or not able to do certain things or can't remember what had happened. They become this part of the sign and symptom of Korsakoff syndrome with heavy drinking, because they become able to rationalize their intelligence, able to rationalize or cover up their forgetfulness.
Okay, all right. So, Mr. Lawrence, when we talk about dementia, can I say that it is one big umbrella whereby it can you can divide this dementia into Alzheimer, what do you call just now, Kasowski? Is it different?
Body, yeah, Korsakoff syndrome, yeah.
Right. So it's so all this is under dementia.
Yeah, under dementia. You see, the actual causes or diagnosis are not usually, we almost can, what they call it, in a way, guessing it. Because the actual diagnosis is when the person suffering from dementia dies, when you open up the brain and do the slice looking at the brain, looking at the brain itself, the sign of the affected part of the brain will tell you what actually the actual type. Those rare type of dementia, besides Alzheimer's, are very rare, to be honest. But most of people that die of dementia don't normally contribute their brain for research. So it's very hard to say, to be exactly. Certain, you find it, not everybody's dementia behave exactly the same, but ultimately, the affecting part of it is the unable to self-care, unable to recognize, totally disorientated, totally don't know what they are doing. So these are the ultimate, unfortunately, sad cases. It's a very, very sad cases to anybody suffering from dementia.
Yeah, I mean, especially for the carers, actually, it's an overwhelming.
Yes, it is. Yeah. In fact, I come across, I've seen people on the early onset and deteriorated very fast.
Huh.
In fact, they are in the beginning, they find it, they have like somebody like I always seem to forget, something, but I don't know. But as their short-term memories progresses, in fact, the person suffering most because they are trying to reasoning up why they cannot remember things. They couldn't figure it out. They're struggling there. In fact, they are the one, I feel very sorry for them because they couldn't figure out what happened to me. I was able to do certain things. Why I can't do it? You know, they're struggling. But once they pass the stage of self-awareness, then of course they're living in a different world.
So, but Mr. Lawrence, from your experience, what is the youngest age that you have encountered with patients with dementia?
But mainly because I was in the main elderly care. I usually pre-senile and senile dementia. Usually, I say in terms of medical, is over 60 onwards, all right? But the younger one you can get, unfortunately, getting younger and younger, people over 50s and starting coming 40-something, started to having dementia, especially people with experience with drugs. You know, they're drug takers, they affect the brain so much. So the symptoms start to showing up in the early, late middle age. You know, these are the signs that usually these are often caused by external influence, like alcohol and drugs intake, LSD and marijuana. So these are the things that causes the trigger off quite a lot of dementia.
Okay.
It can be as young, it's getting younger and younger, unfortunately. Besides the accident, the trauma, that brain injury that because of an accident or stroke. So people who are suffering from stroke or hemorrhage of the brain can have dementia because of the injury. So those are external causes. Let's say a so-called natural causes, the age group wise, are usually it's not necessarily that because you are very old, you will get dementia. A lot of people have very sharp mind when they are even in their 80s. So it's not that just because we go old, we will get dementia. No, it's not. So people always misunderstand dementia just because you grow old. It's not, unfortunately. People always misunderstand that. Any other question?
Yes, Mr. Lawrence, and there's a question actually asking like how, like we do, like normal people like us, we do forget things. So is it one of the signs and symptoms towards dementia?
I don't know. I don't think so because memory lapse. Because what psychologically, because we are preoccupied with something, and it's quite normal to have short-term memory loss. But usually the memory comes back. You see, let's say you walk in the room. I mean, it happens to most of us all the time. You walk in the room want to get something, but as soon as you walk into your office or your room, and you walk in and say, "Why are you coming here for? I want something, but I can't remember what." So you went out. Okay, it may be in about 15 minutes time, then you recall, that's what I want to get. You see, these kind of short-term memory loss are not signs of dementia. They are just a normal preoccupied thing. So it's not. So don't just because you have one or two lacks of memory that you think you got dementia. No, don't frighten yourself unnecessarily.
Yeah, so don't worry, participants.
Yeah. But if it happens too often, that's another story. You know, it happens, almost every 2 days, and you start to worry, to be honest. Otherwise, nothing wrong with that.
So like, if you suspect yourself to have dementia, so what's the steps that you suggest us to do?
As I say, try to keep yourself active, very important, mentally. Try to stimulate your mind, try to occupy, like problem solving, exercise, good diet, good sleep. Once you get it, hopefully, it's not a very nice thing to say. In my care of the care for the elderly with dementia is to prevent or delay deterioration, from let the person or stimulate the person as much as possible so they can do things for themselves as long as possible. So you try to delay the onset of the full dementia, right? That is the care and objective of any elderly care with dementia units, because at present moment there is no effective treatment of dementia, although we know that happening that the plaque generation happen, amyloid plaque start building up in your brain, your tangles, your neuron fibers, tangling there. So although we know physically there are brain changes, even if the X-ray and see the brain actually shrunk from the X-ray, this is part of the physical sign that you can actually see. But unfortunately, at present moment, the science still not able to find out what causes this kind of changes. So until they find the causes of these changes, then we find a cure. At present moment, there isn't. So if you have suffering from dementia, is to try to keep your brain active, good healthy food, go to countryside, don't live in the city with pollution. That will be my prevention.
Okay, so Mr.
Plenty of champagne.
Yeah, that's the most favorite thing that I like to hear that. Anyway, Mr. Lawrence, Mr. David Ng has a question over here. Would you encourage coffee for dementia patients?
Encourage?
Coffee, consuming coffee?
There isn't any scientifically medical proven that anything you take often that affects your brain. Anything, of course, toxic things and a chemical, yes, it will affect you, because you see the food we're taking is a lot of chemical in it, preservative and all those things. So the more you have natural things, the better. All these stimulation like coffee, tea, even alcohol, it has certain function or stimulation of the brain, but anything excessive is always bad.
Yeah, everything has to go in moderation.
That's right. Yeah, that's it. Yeah, you cannot just say one thing causes it. There isn't. It's usually a combination of a lot of factors.
Yep, a lot of, yeah. And it's hearing loss or hearing loss linked to dementia, according to Mr. Ronald Chong, his question.
Hearing loss is, I think, that's another physical problem, not really to do with there isn't any link with hearing losses and dementia. I mean, medically, there's not. I didn't come across personally, but after saying that, like other, as I said, Alzheimer is really the major common diseases, like Lewy body, Pick's diseases. These they have a different set of additional symptoms which are quite rare. So therefore, I cannot say it is the sign of dementia, not because you've got hearing losses or eyesight. It's of course the hearing losses, your eyesight and smell and taste are all due to other physical causes, not necessarily it's dementia.
Yeah, okay. And I guess like Yong Kang's question is that if you have diabetes or hypertension, will this be the prerequisite for dementia or Alzheimer's disease in future?
Well, unfortunately, the more physical illness you got, it does not help. Let's put it that way, isn't it? When you talk about diabetes, because of the insulin and the blood, your hemoglobin have been coated by a film that the exchange of oxygen within your tissue affects the body, especially your preferable, your legs, hands, fingers, and all things. Also affect your brain. So the more physical diseases you got has something to do with oxygen exchange within your body, then the more likely you would have trigger off the dementia.
Oh, but Mr. Lawrence, dementia does affect the speech, right? For those patients.
Yes, definitely.
Progressively.
Yeah, language and speech, yes.
Yeah, that's what happened to my mom, though.
Yeah, they usually have. In fact, very strange enough, I used to come across a patient I was giving musical therapy with, and then she's an English lady, and suddenly she talked. I thought she talking gibberish. Then one of my students said she was talking French. You see, that is not her basic language, and yet she learned French. She was able to talk French very fluently. Wow. And yet she cannot have a normal conversation, English conversation with me, partly because I don't know French. Then I discovered that, the person like secondary language come back in. They may have a gift of a certain language. So it triggers part of the brain that speak a certain language or impair their speech. They may be very fluent originally with English. They may forgotten how to speak English. The brain is a very strange mechanism.
And Miss Ratnaswari asking that it's medical insurance covered dementia illness, and
I can't answer that. No, that you have to ask the insurance company.
Yeah, I think for my experience, no, there's no coverage yet for this illness. And for nursing home stay, nope, you have to bear on your own. But if your parents previously working with government, then you will have some subsidize on that, some, but not all. Again, you will have to bear the costs on your own for now.
Mainly because I think dementia, there is no, it's not like someone have a cancer, you need certain drug to treat it. You see, even by right, it is an illness. By right, the insurance company should cover it by right. But again, insurance company are not there to do you favor. They want there to make money. Let's be realistic about that. So if they can avoid to pay you, they will. They will get out all the small print. Unfortunately, I worked with insurance company before when I was young. Tried to be a salesman in what they call it, financial advisor. They always love to have your premium, but when it comes to payout, they're looking for clauses not to pay out if they can help it. Unfortunately, that is commercial insurance.
Yeah. Okay. And from Miss Chan Wan Ling, she mentioned that if someone already showing some sign of dementia, like forgetful, losing language, etc., is there anything else we can do to slow down the deterioration? I think just now Mr. Lawrence mentioned that you have to keep the brain active. Is it right, Mr. Lawrence?
Yes, stimulate them with the interest. That music is very important. If they love music, play the music that they love. Yeah, even like playing mahjong. If they have the old habit of playing mahjong, it should stimulate them to play mahjong. Maybe to win or not. That's not fun. Remember, I remember I was in London Guy Hospital. I went into the hospital ward and looking at this surgical ward. I seen a doctor, elderly doctor, standing there. But everybody is busy, but he seems to be wandering around and just standing there looking around. Apparently, this doctor is suffering from dementia. So they put him in a work situation, a familiar, which is all his life been doing it, so that he can familiar with the same surrounding as long as he doesn't do anything. Keep him calm. So people with such signs of dementia, it's important to give them stimulation, give them rehabilitation. Keep repeat telling them. Don't assume that they'll understand what you say. You may need to continue repeating what you want to say again and again and again. But bear in mind that because they cannot retain the memory what you say to them, what you say they cannot retain in the memory within, you can be in seconds, they can forget.
Yeah.
They may respond physically, or nod the head, or shake the head, or smile, and yet it's some sort of like covering up. They don't know what you're talking about. If the son or daughter, they can't recognize the son or daughter or their loved one or husband because they look at the face. They know this face is very familiar, but I don't know who it is or she is. That is what's happening to someone who is having dementia in the late stage.
Yeah, and actually I want to share as well, like when I did like introduce new hobbies to my mom when I suspected she has dementia, but she get very agitated because she feel the pressure. So as a carer, I think the key point here is we have to be patient to they are very quite moody in sense, yeah, right, Mr. Lawrence, and they get angry very easily, and
because they get frustrated. They get frustrated themselves.
Yeah, so I think the key point here is really to be patient and
let them do like things they like. Don't try to change them, because if there's something they don't like to do, don't try to. Although your intention is good, right? You try to create a hobby or certain thing. If they don't like it, skip it. Get something they like. You get a simple puppy. You start playing with the puppy, or feed the dogs, pet the dogs. Something that's very simple. Maybe you create a bit more work for you having an extra pet in the house. But if anything that can stimulate the person's interest, that can occupy them, it helps. That's an important thing, If they like to do, let them do it, as long as there's no danger to themselves. Of course, always remember, we have you don't lock people in the house. Say there are the tricks that are usually advise people. You cannot lock the door in case there's a fire. The person, nobody can go in. But sometimes there's a trick that the door handle, you push down to open the door handle to go out, right? You install two door handle. One is up, one is down. But the other door handle is, instead of pushing down, is pushing upwards to open the door. So you need a little bit of intelligence to open a simple door, and yet the door is not locked. Right?
Yeah.
Prevent patients suffering with dementia going to the kitchen because of the gas cooking. Because if the person going to the kitchen, especially your mother or sister, they want to do cooking, they turn on the gas, not automatic. The spark will come on, especially you need lighting one. Then it become a danger because the gas will come out and people don't realize, go into the kitchen and try to switch on the light, there will be explosion. So these are the things that you prevent people going to the kitchen, dangerous areas that the patient may not realize the danger. Just like you're looking after a newborn baby, to anticipate danger before it happens.
Okay. Yeah, Mr. Lawrence. Okay, I think there's a few more of a quick one. So Miss June, she's I think a nursing student. So she has to assess patients' short-term and long-term memory. So she wonder if date of birth is suitable to assess long-term or short-term memory. Wow. Okay.
Well, actually, it's quite simple. Actually, we do that to assess most people coming from with dementia. Short-term memory is very easy to assess. Like I say to you now, apple, tea, and banana. Okay, I want you to remember apple, tea, and banana. Okay. I would ask the same question again in 5 minutes time. So if I say to you now, what did I say to you, the three objects I asked you to recall earlier? Can you tell me? Can you tell me what is it? If the person can tell you, that means the short-term memory is good. If they cannot tell you apple, pea, and banana, then the short-term memory is bad. The long-term memory is quite often you have to pick up from the family in the way you lived before. You must get history from the family. Let's say you live in Ipoh, okay, last 20 years, in 1950, okay, or 1980s, they live in Ipoh, a wage pile Ipoh. You may ask the person, have you ever lived in Ipoh before? Long-term memory, they will able to tell you, yes, they are, and things like that. If they cannot tell you, it's wondering. Like example, the short-term memory is who is the Prime Minister at present moment? Any one of you can tell me? If you cannot, that means your short-term memory have problems. So if I say to you in 1957, Merdeka Day, who's our first Prime Minister? For people with intelligent or educated one, can you tell me who is our first Prime Minister in Malaysia? So that is long-term memory. So that's how you usually assess people long-term and short-term memory. Short-term memory, you create a sentence for them to remember and ask them again in 5 minutes time. That's how you assess them.
Yeah, great. Okay, thanks, Mr. Lawrence. I hope, June, I hope Mr. Lawrence has answered the question. And thanks, Ms. Deva, to answer those questions about how to diagnose or check if your parents or grandparents have dementia. So you can, any GPs should be able to do so, right, Mr. Lawrence? Like simple cognitive tests to screen for losing memory and so on.
Yeah, the screening part of it, there is a system, call it screening for dementia. There is a very simple things to do, but usually we use it in clinic testing by the doctors, all right? A list of things for you to do. Like I say, ask a simple question and then ask them again, what did I ask you? But the family history, of course, you have to base on your own family to tell you, did your uncle got any, in Tanjung Rapatan, or has anybody is suffering from mental illness or even suicide, committing suicide in your family, your uncle, your next of kin or nearest relative. So you trace back from your own family. You have to ask a lot of questions for your own family. The doctor would be able to tell you whether you actually have any family history. You are the one who supplied the information rather than the doctors.
Yeah. Okay, great. Thanks, Mr. Lawrence. I think one last question, Mr. Lawrence. Okay, wait, yeah, Cynthia has question about if you keep a dementia patient's brain active, is it possible for full recovery? I would say no, yeah, right, Mr. Lawrence?
I wish the answer is yes, but
exactly.
Unfortunately, it's very sad. Hopefully,
Yeah.
after saying that, the research saying that because they have discovered the new system in 2021, all right, the lymphatic system is the fluid in the brain that wash the amyloid plaque. They may have found a cure for it. I think next 30 years time, you might be able to find it. But meantime, to be honest, there is no cure or actual known medicine that can cure the
dementia.
We know that what's happening to the brain when someone suffering from dementia. After the person dies, we take the brain out, slice them into under the microscope. There are changes like the brain itself shrunk. So there are a lot of physical changes in the brain. We notice that result of dementia, but most of the time we do not know what causes that kind of changes. Why, like the amyloid plaques are accumulated there, or the tangling the things that neuron tangling fiber, in the brain that result of dementia. Until we find the causes of this happening, then we found the cure. After saying that, they start slowly approaching the chances of there may be a chance of a cure, but at present moment, we try to prevent deterioration is more important. The patient getting worse. Unfortunately, of course, it depends on individuals. Some people, as I said, deteriorate very fast within 6 months from walking to a bedridden, and yet somebody still walking around after 5 years. So individuals are differently.
Exactly. My mom's case is pretty fast, though. I think it takes about months. But Mr. Lawrence, now is gene therapy actually used to relieve the dementia problem?
Sorry?
The gene therapy, have you heard about that?
Gene therapy?
Yeah. Are they
well, I mean, if you find what, I mean, and in terms of a sign, if you can find the fault, where the fault is, and change the gene, yes, cure anything. To be honest, any diseases, if you know what, gene A and gene B, you can change. If the faulty B, we can change the B to a new B, and of course we cure everything. I mean, the present moment, I don't think that is scientifically proven that the gene actually do the, just like all these so-called, again, changing things are ethical or not, I don't know.
So we hope now the newest generation, like all the science students over here or nursing students, please do look into this research, to cure dementia.
But you see that if we can get more people to donate their brain or their relatives' brain for research, it will be, because not many people willing to donate their brain, people suffering from dementia, for scientific research, especially not in the Eastern world. Western world, we still can get some donation, of the brain, because you need a lot of brain to cut into all these brain to look at the changes in dementia, and yet basically we know what is happening to the brain when someone having dementia, but we don't know what the causes of it. So the sooner we can find the cause the changes in the brain structure, then we found the cure.
Okay, and Ms. Deva also shared about dementia, more about dementia. There's Alzheimer Disease Foundation of Malaysia, where you can contact them, and there's address posted by Ms. Deva. Thank you so much, Ms. Deva, to share this. So I think because it's already 3:08 right now, I think we will stop here. So thank you very much to everyone that came to listen to the talk, and thank you, Mr. Lawrence, to share with us this enlightened information. And it's very informative for now, and we have learned a lot. Thank you so much, Mr. Lawrence. And everyone, please do stay safe and do sign out, using the link as attached by Mr. Kartik on the chat, in the chat box. Thank you so much, everyone. Thank you, and stay safe. Thank you, Mr. Lawrence. I hope you have a great flight and safe flight back to UK.
I hope so.
Stay safe, hopefully.
Yeah, okay.
All right, see ya. Thank you.
Okay, thank you.
Oh, Mr. Lawrence, or you have any, do you mind, like, if they have any further questions they would want to contact you? You have any email?
You're welcome. You can give them my WhatsApp, so you can do that. If you mention that is from what do you call it, from Utah, and then I don't mind answer or email to me, although I don't always check my email, but now I tend to use my WhatsApp more. If they have any question or any help required to look after their family or problem solution, I'm quite happy to give them advice over the WhatsApp.
Okay.
you know,
Yeah.
no charge.
That's great. That's great. That's great. All right. Thank you. Thank you, Mr. Lawrence. So again, if the audience, you have further questions or you need any help, yeah, you can message or email us. Then we will link you back to Mr. Lawrence.
Yeah, also that the book on dementia, I mean, in the first
Mental
aid,
health.
mental health, that there are a few what you call it, a chapter on it. So if you want to buy the book, there also that will help for as a reference.
Okay. Great. Great.
You can let them know where they actually the book they can get through me on the WhatsApp. They can't
Okay.
get it from the bookshop.
All right. So if we get any request for that, then I'll come back to you, Mr. Lawrence.
Yep. Mm-hmm.
Yeah. All right. Thank you, Mr. Lawrence. You stay safe. Thank you.